Hi, my name is Nicole Daniels, and I'm going to discuss the importance of smoking cessation during pregnancy today. This is my health education program, and I'm a student at Indiana State University and the LPN to BSN program. The population at risk that I will be addressing today will be targeted towards adult women or young adult women who were recently discovered that they were pregnant or in early stages of their pregnancy. The objectives for today are to identify populations at risk for maternal smoking, describing the risks and outcomes associated with smoking during pregnancy, describing barriers to smoking cessation that women experience, to list the many different resources that are available that can help mothers to abstain from smoking during and after pregnancy. Before we begin, we're going to pause to take a pretest so that you can check your knowledge. Below in the information, please note that there is an attached pre/post test that you can take now, and then again at the end of this presentation. Test how much you knew before and after. Please take your pretest now. All right, so to start our presentation, we're going to discuss the populations that are affected or involved. The prematernal rates of smoking in the United States by ethnicity are broken down such: 47% Native Americans, 46% white or Caucasian, less than 20% consist of African American, Hispanics, and Asian Pacific Islanders, and then 6% Alaskan Natives. With increased risk, certain characteristics are notable, such as low socioeconomic class and income, lack of significant other or spousal support, previous history of depression, and just overall lack of familial support or a support system. Some risks that are associated with smoking during pregnancy: complications that affect fetal development and growth, lifelong complications to your child's lungs or other body organs, and this could be due to the decreased oxygen supply and other nutrients during development. Preterm labor or low birth weight, sudden infant death syndrome, childhood obesity, miscarriage or stillbirth, and neonatal mortality. The cessation is important. The impact is clear. In a study that was done, it was found that 14 to 30% worldwide, people that continue to smoke during pregnancy. However, it should be noted that that number could potentially actually be more and much higher. And that's due to the fact that because of this stigma that surrounds smoking these days, many women are afraid to disclose that information to their physicians. They're not comfortable. The results of smoking cessation on pregnancy outcomes is also proven. For those who continue to smoke during pregnancy, they have a double or 2 times the risks of those that those that do not smoke or abstain from smoking. Some barriers that women face when they've made the decision maybe to quit smoking. Number one, psychological well-being. They might be using smoking as a coping mechanism for stress. Second, relationship with a significant other. Perhaps your spouse smokes, and if they continue to smoke, that could also be a very large barrier to cessation. It makes it more difficult for you to smoke when your significant other smokes. Your own appraisal of risk. What do you know about the risks? Do you understand those risks? Worrying about adverse outcomes of quitting, such as gaining weight. Many women, especially Caucasian women, worry about weight gain as a result of quitting smoking. Lack of support. And then lack of knowledge, not sure how to do it and where to get the resources or support from. Please note also that use of e-cigarettes. Some people think that e-cigarettes are a good alternative to smoking. However, many people do not realize that e-cigarettes pose similar risks. So where do you begin? So the website attached, women.smokefree.gov, has many different resources available. You could follow this link, you can develop your plan. It also reviews talking points that you can go over with your physician in regards to how you're going to quit. It also determines how you can determine your triggers for smoking and then what you should do to avoid those triggers. And then it lists multiple tools that can be used for women, mothers and women, to help them quit smoking and to continue to abstain from smoking, such as the text messaging from Smoke Free Mom, which provides 24-hour support and assistance, setting goals, Smoke Free Women Facebook group, where you can speak with others that are going through the same thing as you are, smartphone apps to aid in quitting. There's numerous different apps that you can look at on the website, and then also a 1-800 number for online counseling or via telephone. Quitting is easier, of course, as I mentioned, if you have support of those around you, such as a spouse or other family. And education is key. So if you're trying to get that buy-in from your spouse for them to have a reason to support you and also decide to make the jump into smoking cessation, the World Health Organization article attached below provides detailed evidence of the importance of smoking cessation in pregnancy on outcomes for your child, but also the importance of spousal cessation in order for quitting to be successful for the mother. The March of Dimes website provides education on risks to the mother and baby of smoking and secondhand smoke, as well as thirdhand smoke, and the risks of using e-cigarettes, and also provides more tips for quitting smoking. Finally, on the CDC website, you can find some different stories. One of them is Amanda B's story. This is the story of a woman who struggled with smoking while she was in college as she was pregnant. And as a result, it depicts how she went into preterm labor, delivered a preemie infant, and weeks of NICU therapy that they went through, and that life in the NICU, and the struggle that her child has faced over the years. Really good story, good information for moms to review, and there's videos of the journey as well. Okay, so here are some other references that help to show some of the information that we came up with today. So please take the time to take the test again to test your knowledge, and take a look at the handout attached below to go with this presentation as well.